The United States is having a challenging time in the last decade with tragic deaths, maternal deaths, and severe injury. We have a long way to go as far as planning for every patient, the best care, the level of care that they need. We have sepsis, hemorrhage, cardiovascular disease, all of these factors that are attributing to poor maternal outcomes. Each new patient from the time of pregnancy should be evaluated for the appropriate level of care that that patient's going to need. So it's a maternal fetal surveillance system which shows the maternal vital signs, the fetal heart rate waves, the uterine contractions, the maternal pulse ox, and through these features, the clinician can be taking a close look at exactly what's going on with the patient. These surveillance features allow a clinician to see a decline in a patient condition and rapidly intervene and make medically appropriate decisions. OBIX continuously scans the country for standards of care and embed in their system the latest and greatest of whatever clinicians need to make sure they're taking good care of their patient. For example, AWHONN's maternal fetal triage index is embedded into the triage form so that a patient that needs a higher level priority of care is quickly identified and gets the care that they need. The OBIX system is also Meaningful Use certified, reflecting OBIX's commitment to meeting the standards of care across the country in order for our customers to take the best care of their patients. We're all in this together to meet the same goal. We all have mothers, sisters, daughters that are also going to have babies, and we want to make sure that everybody has a healthy, happy outcome. Nurses are specifically heavily burdened with their patient assignments. If a patient that was having a difficult time with, say, hemorrhaging or sepsis, they would normally be in an intensive care unit with one-to-one assignments with their nurse. Where in OB, often they have 4 to 6 patients because they're considered postpartum and therefore lower risk, and that's really not the case. They still have great risk for hemorrhage and should be at a closer rate of care with their nurse and their care provider to prevent the problems that we're seeing happening in our country today. OBIX documentation includes QBL, or quantification of blood loss. So that's a national standard that we should be meeting. Rather than estimating what a patient's blood loss is, it encourages or forces the clinician to be weighing pads and measuring blood loss so that we know specifically and exactly what that blood loss is, therefore prompting the possibility of hemorrhage and earlier intervention by the clinician. Additionally, vital signs that change dramatically during a hemorrhage, blood pressure that's dropping, a pulse that's rising, everything's displayed in an OBIX surveillance system. So minute by minute, as that data is being pulled from a fetal monitor, it's displayed on the OBIX surveillance. And so that all the clinicians in the unit, or specifically the clinician taking care of that patient, can see rapidly what those numbers are. OBIX flow sheets help with shift-to-shift communication between care providers. That way, anything that happened to the patient, with the patient, blood loss, medications, etc., it's all right there in a spreadsheet in front of the clinician so that they're able to communicate that to the next shift and nothing gets missed. One of the nicest features of the OBIX perinatal data system are our e-tools that were developed in conjunction with Lisa Miller, who we all know is an expert in fetal monitoring and standards. In conjunction with the NICHD guidelines, we are able to assist our customers or clinicians when they're reviewing traces and using the e-tools to make sure that they're seeing things correctly, interpreting traces correctly, and making, therefore, the best decisions on intervening in their patient's care. Poor outcomes following a delivery, including blood pressure problems, are usually a result of a perfect storm situation. Sometimes there's an underlying condition, and sometimes it just creeps up. So the OBIX system is very helpful in that we are constantly relaying those data points of vital signs to the user through our surveillance system, through the data points of blood pressure, pulse, respiration, and a declining condition is noted very quickly. It may creep up very slowly during a labor, or it may be a condition that the patient arrives with, but there's many factors that can be attributed to rising blood pressure, which can be brushed off as not important, such as the patient's nervous or has anxiety. The labor of pushing raises blood pressure, but what we need to do is make sure that we're keeping a close eye on that patient and their blood pressure and their vital signs continuously, and that's a great feature of OBIX. As fast as a monitor can take a blood pressure, OBIX can display it to the clinician. When comprehensive protocols are in place in order to take care of a patient, OBIX assists that we can see vital signs from wherever the clinician is currently at. It doesn't necessarily have to be at the bedside. It could be from a doctor's office, a remote site. It could be from the OR if that's the way the system is set up. And so that every person working in that unit is able to see a patient's set of vital signs moment to moment, and nothing gets missed. The OBIX system is continuously updated with standards in their assessments, in our charting notes, in our forms. So that assists the clinician to prompt them, what do I need to know about this patient? What is this patient at risk for? OBIX has built into the system prompters or data points of blood pressure, vital signs, temperature, so that if they're abnormal, the clinician and care provider sees those data points quickly and can intervene with the appropriate medical attention that patient needs. There are many factors contributing to the U.S. maternal mortality and morbidity rates. Some of the problems are avoidable, some of them aren't. We should anticipate potential childbearing problems when we can by screenings, good prenatal care, making sure everyone's at the appropriate facility. You know, we're all in it for the same goal. We all want good outcomes, healthy moms, healthy babies. And things like OBIX perinatal system contribute to good outcomes by giving clinicians the information they need, the data points they need for vital signs, charting mechanisms, surveillance, and hopefully we'll all see better outcomes in the future.